All right, men, listen up. Well, and women, too. Hair loss is a subject that's very touchy for many people, but it's also something that makes a lot of companies a lot of money because nobody wants to lose it. But we are here this morning with an author and a doctor, Dr. DJ Verret, who wrote Patient Guide to Hair Loss and Hair Restoration. And I think you answer a lot of questions and bust a lot of myths when it comes to hair loss.
Absolutely. There are a lot of myths out there, and a lot of people have questions. And as you mentioned, it's a problem that affects both men and women.
Sure.
And a lot of women especially don't want to really talk about it.
Yeah.
And so I think information is kind of the key because there are a lot of treatments these days for hair loss.
Absolutely. And there's a lot of places that people are willing to spend a lot of money to get these treatments. And so you have your recommendations and you have the things that you think do work.
Right, absolutely. The first thing that anyone needs to do, though, is determine the cause of hair loss. For most people, it's androgenetic alopecia, what people term male pattern baldness, but that affects both men and women.
Okay.
There can be underlying medical problems, though, like thyroid disorders, diabetes, several other medical conditions that need to be treated. Once they're treated, it'll actually take care of the hair loss.
Okay, so there are medical treatments, and so what are some of these treatments?
Well, the best treatments, and actually the only ones that are FDA approved, would be Rogaine and Propecia. Rogaine is trade name minoxidil. It's actually approved for both men and women.
Let's bring some of those over here.
The men's formula is a 5% minoxidil. The women's formula is a 2% minoxidil. It's actually available generic as well.
So I was reading something about your book, and it's interesting that Rogaine wasn't necessarily originally formulated for hair loss.
Correct. Actually, all of the products that we have for hair loss weren't originally formulated for hair loss. Minoxidil is actually a treatment to use for hypertension or high blood pressure.
Okay.
The other treatment that's available for hair loss in men only is Propecia. Propecia is finasteride. It is currently used for benign prostate hypertrophy, prostate enlargement in men, but it's also used to treat hair loss in a 1 milligram formulation.
And you do find that these products work?
Yes, absolutely. Now, it doesn't work for everyone. You have to use it for at least 3 to 6 months to see any kind of change. And if you stop using them, your hair will start to fall out just like it did before.
Oh, that's scary. And I've heard, though, with some of these products that you actually have to start using them before your hair ever starts falling out. Is that true?
Well, you should use them when you first start to see thinning of the hair, because they may not regrow hair, but they should slow or stop the progression
Make it a little
of hair
bit coarser.
loss. Exactly.
Okay.
The other thing that's actually very interesting that's come out within the last year is this product. It's Latisse. It's
right,
very
women.
well advertised.
I mean, these are like $100. They're not cheap.
They're very expensive, but it works very, very well for eyelashes. This is for eyelash loss. And what you do is apply it to the eyelashes. It, too, is a treatment actually for glaucoma. They saw a side effect of increased hair loss, and they got an approval to use it just for eyelash growth. Same thing, though.
Can it still help you a little bit with glaucoma, or?
No, it's a different formulation. You actually use it as drops in the eyes. So 6 to 8 weeks, though, before you see results. And again, if you stop using it, your eyelashes go back to where it was.
That's the bad thing. So you can have these beautiful, long, luscious eyelashes. You stop using them because your eyelashes are continuously falling out. They'll grow back short again, or whatever length they were.
And just like all of the hair on your body, all of your hair cycles, it falls out at some point and then starts to regrow.
Right. Okay.
The other thing that we look at is hair is actually very metabolically active. In other words, it takes a lot of nutrients to grow it. So good vitamins are also essential whenever you talk about hair loss products.
We've only got a few seconds left, so I don't know if is there a final point that you
and then the other thing, once it does fall out, hair transplants, think of weaves, hair replacement systems, that kind of thing. Those are very good treatments, not like the old days, look very natural and can get you a good result.
All right, perfect. And people can check out your book. It is Patient Guide to Hair Loss and Hair Restoration. Where do they carry that? On Amazon?
Amazon.com, BarnesandNoble.com, our website, drverret.com.
drverret.com. A lot of good information, and I know it's a topic that a lot of people are interested in, so thank you so much. We appreciate that.
Thanks.